We are live. Ma'am, you are on mute.
Namaskar. Welcome to this 160th episode of the incredible Gyan Pravah, a stream of knowledge flowing every day under the direction of our revered president, Dr. Sunita Tandulwadkar, ma'am. Everybody knows so much about her. What they probably don't know is the kind of person she is, who's trying to bring up talent, who's trying to promote every Foxian. I remember before her election, she said, whether you are elected, you are not elected, you are going to work for me. And this she has taken to every society, so much so that the societies, there are 286 societies, and they are bus बहुत कर लिया, everybody has had their full and more, and there is still so much more to do. So ma'am, hats off to your vision and the way you are making everyone feel a part of Foxy. Yes, we are all connected, we are all one, and we can all contribute in our own ways. Welcome, ma'am, to this podcast for your views.
Thank you, Asha. Thank you. Foxy is not a one person society. Foxy, even the organization, is led by not just the president. President is held by 5 VPs, then one joint secretary, secretary general, joint secretary general, treasurer, joint treasurers, and 30 committee chairperson. President probably works more closely with this 30 chairperson because they are in pan India. They work at multiple levels apart from their own subject in which they are chairing. They also help with their passion on the subject. So, Sarjanji, it's great pleasure to have best of the chairperson of our country. I thought by doing this podcast, I'm trying to help them, to evolve when they will be committed that every month on 7th I'm coming for the podcast, what podcast I should do, with whom I should interact, and then when they get the personality, then what questions they should be leading. So it's giving a food for thought than just doing the routine CMEs and all. But I felt by meeting 160 personalities pan world, pan, it's not pan India, it's a global personalities which come in. I probably got evolved as a person. I get to know how many, politicians, they think so differently. The IS officers, the social workers, the academics, we had from all the field. I think somewhere in this week we have a president of cardiac society also. So sometimes you feel it is so great to interact and to know amount of work they are doing with. So I'm so thankful today you are here to witness one of the Foxes probably going to become a historical with 360 podcast, everyday podcast. We are creating history, never knowing that we will create the one. So thank you for being the part of our wonderful journey today.
Thank you,
Thank you
ma'am.
so much, ma'am. Thank you so much. So today I'm going to talk to Dr. Sarjan Shah. He is the head of Genetic Research and Solutions Private Limited. He did his MD way back in 2008, and since then he is basically working on research in genomics in areas of newborn screening, HPV, nutrigenomics, and microbiome. So normally a pathologist will be, what the villagers will call, it's just getting the urine and blood tested. But he has taken that urine and blood testing way beyond what is normally considered normal. He has gone into the field of research, and now he is looking into the effect of the human microbiome on different disease conditions. A leaky gut, everybody knows, but its relation to HPV, its relation to preterm labor, its relation to multitude of diseases, endometriosis, infertility, semen problems, and the so-called IBS. So today we will get an idea of what exactly is a microbiome. Because when you talk, what is a microbiome? Most people, it's like lactobacillus is maybe Dodeline bacillus. That's as far as they go. So, sir, I would start my program with asking you, welcome very much to this program. I hope you have a great time, and I hope our viewers have a great time as well, and they take home something positive from this podcast. So,
Thank
I
you,
would
Asha.
thank you, ma'am.
Thank you, Asha. Before I take a leave, just to inform you that just day before yesterday in Meerut, we discussed only on microbiomes. The importance, see, science is evolving, our understanding is evolving, and how microbiomes in a regenerative medicine also, the good one, the bad one, forget only endometriosis and other things, but so many other diseases we talk about, whether their origin and how we can help ourselves to get them off is very, very important. And I'm so happy that you have taken microbiomes, the topic, a beautiful food for thought for everyone to sleep with. Thank you. And I will connect with you because we do, sir, a lot of regenerative medicine. And I'm not aware of your lab, whether they do telomere length and all the studies which we do for our patients. And we give lot of anti-aging like NAD therapies and others. Just now I gave an interview to Times of India. And whether your lab will be, we can collaborate. We are doing with the lab in Bangalore, and they do the telomere length and everything for us. So we will connect once, and I will make you connect with my team at Alive. Thank you. Looking forward for your not only the dialogue, but connecting you and seeing you sometimes in person. Thank you.
Definitely, ma'am. Thank you so much. And this is just amazing how I came to know from Ashaji that, this is the 160th episode. And as I was telling you, I mean, I've never heard somebody doing this. We must actually apply for Guinness Book of World Records once we
I
finish.
think so. Once.
And it really feels really privilege and pleasure that, Ashaji actually called up and said that we want to do this podcast. And thank you so much for this opportunity as well.
Thank you.
And really looking forward to this 1 hour of discussion.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am. Namaskar. So we take the program forward. Sarjanji, can you just explain what is a microbiome? What is it?
Right. So, microbiome is collection of not only bacteria but fungi, viruses, archaea. All this coming together is microbiota. And the genes they contain, the collection of these genes is called microbiome. That is the genetic analysis of these bacteria, archaea, fungi, and viruses. So they are about 100 trillion.
What four did you say? Bacteria,
Bacteria,
fungus,
fungi,
virus.
virus, and something called archaea.
What is
So these are
archive?
different organisms. They don't come into this. That's a fourth category of organism, one which also are part of the whole system of microbiota. And now
Okay.
the studies are happening for fungi, viruses, and archaea to find out their role in health and disease as well.
Okay.
So in body, they are about 100 trillion in number. And as many cells are there in the body, as many bacteria and fungi, archaea are there in the body. Their genes, they outnumber the human genes by the factor of 150. So these many genes one needs to analyze to know their actual, role in health and disease. So specific techniques are required for that.
I just wanted to ask you, it's a one-off question from my head, top of the head, that you said that each person has 300 trillion.
Yeah.
Yeah. So are they something like a fingerprint that each one has different, or there is some commonality in them?
So there is a commonality in them, of
Mm.
course, but only to a certain extent. Otherwise, each person has different diet, different genetics, different environmental, factors which affect this microbiome. So yes, you are correct in saying that this can eventually become a fingerprint for a person, because it is even said that before the person enters, the aura contains the microbiome, and aura enters first into the room. So that microbiome enters first because they are present everywhere. They are present, of course, in oral cavity, to gut, to rectum, to vagina, cervix, endometrium, seminal fluid. So they are present everywhere, basically.
So they could be used for fingerprinting,
Absolutely,
like in the
absolutely.
future.
Yes.
Now, another question related. You have twins, right? Identical twins, same environment, they are born,
Yeah.
same parents, same environment, same food. So maybe around 6 months of age, would they have identical microbiome or would it be different?
So I'm glad you asked this question actually. So in back in 2013, there was a Stanford research which happened with twin girls. So one was obese and one was thin. So people,
Were they identical twins?
yes, they were identical twins.
Okay.
So they took one female who was obese microbiome and put it into a mouse,
Hmm.
and that mouse gained weight, and they put in that mouse which had gained weight the thin girl's microbiome,
Hmm.
and she lost weight. And so this is how they completed the cycle and said that even if one is an identical twin, still their microbiome will be different, can be different, and have different implications.
No, but you are talking about adults. I'm
Yeah,
not talking about adults. I said at 6 months of age, when
right.
they have both been breastfed up to that point of time.
Right, right.
So would they have an identical microbiome or would it be different?
So again, the microbiomes, of course, starts at newborn. They might have a same microbiome, because if they are born through normal delivery, they'll resemble that of mother's vagina. If they have a cesarean delivery, they'll resemble that of the skin of the mother. But then after a certain time, if they're only breastfed, they'll have the same microbiome. But let's say if they have fever in between, they have been given some antibiotic, they've been given some NSAIDs. Even NSAIDs like paracetamol can, change the microbiome. So they have a huge
How?
effect on it,
How?
because the microbiome and NSAIDs, once the NSAIDs are given to the baby, there will be a inflammation there. And this inflammation reversely will change the microbiome. Microbiome can produce inflammation, but NSAIDs itself going as a foreign particle first time into baby's stomach will create a certain reaction that will change that microbiome. So if that person is given some medication, she will one will have a different microbiome, and the other will have a different microbiome. If they are given they are
But
given,
my question was if they were in identical conditions, it would be the same.
it will be the same. It'll change
Okay.
by 1 year
Now,
of age.
one more question arising again out of what you are saying, that we have preterm babies.
Right.
The incidence of preterms are so high.
Yes.
Those babies are in NICU. Or even if they are not in NICU, they are more prone to infections. They get pneumonitis, they get
Right.
antibiotics. Okay, small for dates babies similarly will have to have some antibiotics. They get very easy pneumonia. So, does that affect that microbiome? And for how long? How long for it to revert back to normal? Supposing they've finished their antibiotic today, in how many months will their microbiome come back to normal?
So it is said that it takes at least 90 days for a microbiome fully developed in a antibiotic. If you have given somebody antibiotic, it will take at least 3 months to 90 days for that microbiome to fully develop.
Okay.
Yeah.
Okay. And these kids whose microbiome is disturbed at critical period in their growth, is there any study that tells the long-term effect of disturbing their microbiome? Because we have studies that if a baby got is preterm, then this is the outcome. We also have studies that this baby has had diarrhea or has had antibiotics, and what is the long-term outcome? Has had oxygen, and what is the outcome? But has there been any study to say that, the microbiome was disturbed and therefore this is the long term outcome?
Not yet, because the sample is a problem in those babies. So once they are in NICU, That stool sample can be taken, but we cannot take any other upper gastric sample or things like that. Stool sample will give us an idea about their microbiome. So that again, if they are hospitalized, they are in the hospital under antibiotic, as I said, it will take a longer time for them to develop. Specifically, they should be given also probiotics.
Is there a long-term sequelae of disturbed microbiome?
Of course, there are a lot of things which can go wrong. Even we say we have found a role of microbiome in all the NCDs also. So all the
Can you
non-communicable.
just dilate upon that a bit?
Yeah, so there are adult studies which I have done in NCDs, role of microbiome in NCDs, like non-communicable diseases, even diabetes, heart diseases, allergic conditions like asthma, then cancers. Even cancers have a huge role of microbiome. And basically, if we say, let's talk about diabetes. So diabetes is, as we all are aware about leaky gut. So what does leaky gut eventually does? Of course, it does inflammation.
Can you explain a leaky gut? What is a leaky
Right.
gut?
So our intestine has three layers basically. One is an epithelial layer. Above that, there is a mucin layer. And under the epithelial layer, after the mucosal layer, there is lamina propria. So there is a tight junction which is there because of this epithelial layer. It is like a uh, they are like we used to see in those movies where somebody is with the shield, they are just standing next to each other, so there is no gap in between, and there is a beautiful mucinous layer which is actually digested and formed, both done by microbiome. Specifically, there is a microbiome called Akkermansia that does all this mucin production or mucin metabolism. This keeps the epithelial lining away from harmful substances. Now, what are the harmful substances? It could be drugs, it could be antibiotics, it could be toxins, it could be environmental toxins, it could be stress as well. So all these pathogenic or toxic material stays away as long as the mucin layer is there. Now, there is dysbiosis. There is increase in pathogenic organisms like E. coli, Prevotella. What happens with this is there is no replenishment of this mucin layer. And because of that, with these pathogens and toxins, they they attack the epithelial lining. And once they attack the epithelial lining, the barrier is broken and they pass through the epithelial layer into the mucosa and lamina propria. Now, lamina propria is the one where all the lymphatic vessels and blood vessels are present. So this is how the leaky gut theory came into picture, that once there will be a leaky gut, all the pathogenic material, the dysbiotic organisms will reach the lamina propria and travel to different organs of the body. And this is how the dysbiosis leads to leaky gut. So once this leaky gut appears, so in intestine, there are two types of cells. There is L cells, there is goblet cells. So these cells produce something called GLP-1. It's become very famous now in media, GLP-1, because now there are so many drugs coming, all the
Anti-obesity drugs.
anti-obesity drugs. So all these Bollywood greats are taking it, and this and that, all these controversies. So, but what is GLP? It's a glucagon-like peptide that actually controls the glucose metabolism. It actually controls your appetite. It controls the leptin hormone. It controls the insulin release by causing proliferation of beta cells in pancreas. So all this is done and maintained when you have a good gut. But once you have a dysbiotic gut, then all this gets hampered. There is increased emptying time. There is decreased insulin. All this leads to diabetes. So there is this theory which has come into research, that this is how it causes NCDs.
Okay, and what about the Helicobacter bacteria pylori infection?
Right.
Every second person is having it.
True, true. So for that also, now there are certain probiotics which are actually correlating very well with H. pylori infection. They cause decrease in H. pylori infection that needs to be given either after antibiotic course or after 2 hours of antibiotic. That every treatment needs to be given probiotics. So
How
once
long?
those,
How long?
see, probiotics can be given for 3 to 6 months. Then dietary changes needs to happen, because most of the probiotics which are available in the market, they are not live. Very few probiotics are live organisms. Only live organisms can actually make new organisms and actually make them colonize there. But
So
otherwise,
that means all the companies that are coming and telling us ours is better, it has 10,000, ours has 1 lakh,
yeah,
but we need to know that it has to be live.
actually, yes.
And
It
if it has to be live, then it should have a need for refrigeration.
Yes, absolutely. That is the
If there
exact
is no need for refrigeration, that means it's basically eye wash.
basically, yes, yes. No, so there is something called postbiotics. So what is postbiotic is the chemicals which gets released, which are helpful in metabolizing all these processes. So they do help. It's not that if you're taking probiotic and they are not gonna help. They'll help at that point of time. But what you want is as you correctly said, H. pylori, that it doesn't go at all. It keeps coming back to persons. So it prevents those H. pyloris from
Relapses.
coming back. Yes, relapses it prevents.
Okay. So I got a little bit of idea what is a leaky gut. That the lamina propria is not behaving as the barrier that it should.
Right.
Right. So
Correct.
now we go to where our topic today is what is the role of these um,
Microbiomes.
microbiota in obstetrics and gynecology.
Right.
So we will go one by one. What do you think is their role in obstetrics?
Right. So throughout the pregnancy, there is a big role which is played by microbiomes. So what we have done is we have analyzed all 3 trimester microbiome data. Now we have that data of quite a lot of pregnant females, and we have seen it changing by the time it reaches 3rd trimester. Because of weight gain, there are so many mechanisms which gets involved, and these starts with a normal microbiome, and there is absolute almost dysbiotic state as far as 3rd trimester is concerned, because of the other processes which takes place, and these processes actually play a role in your conditions like preeclampsia, preterm deliveries, premature rupture of membrane. All these possible conditions, there is a role of microbiome which has been found out.
No, I can understand preterm labor, but what about premature rupture of membranes? But how preeclampsia?
So
We discussed
preeclampsia,
GDM, but
yes, yes.
how preeclampsia?
Yeah. So all the dysbiotic bacteria, quite a few of them produce something called TMAO. So that is trimethylamine N oxide. Now this particular protein or a hormone that plays a role in atherosclerosis and cardiovascular health. They promote lipogenesis, they promote atherosclerosis, and also promotes angiogenesis. Now, these are sort of the mechanisms which are involved in preeclampsia. So there was a study.
Preeclampsia does not involve angiogenesis. Angiogenesis is a factor in cancer. It is
Yeah,
not a factor in preeclampsia, where actually the vascularization is not happening. What should have happened is also not happening.
yeah. So the dysbiosis will prevent this. What I'm saying is that atherosclerosis and cardiovascular health will hamper, and the angiogenesis part is not happening. So what we see in this is that now even TMAO levels are measured to know the cardiovascular health. This is the same mechanism in a non-pregnant person when we are talking about NCDs in heart disease. So this is what TMAO does.
But PIH,
Yeah,
me as an obstetrician, what we say is that the primary and secondary placentation is deficient.
right.
That means the chorionic villus should enter the spiral arterioles, and then the spiral arteriole should lose the muscle.
Mm-hmm.
And when they lose the muscle, then they do not respond to the stress of the woman, and there is a continuous blood supply to the fetus. That is the basic theory.
Right.
And this is started at 12 weeks and finished by 20.
Mm-hmm.
Right. But again, the changes in the microbiota are more pronounced in the 3rd trimester.
Yeah.
They are not so pronounced in the 1st trimester. Whereas PIH is decided right in the first trimester. So how does this correlate?
So in PIH cases, the microbiota changes in first trimester. It does not wait till after 20th week or nearby 20th week to change. So that is exactly we can
What are the
predict.
changes? That's what I'm asking. What are the changes in the first trimester itself, which we can sort of measure and know that this patient is likely to go into PIH?
Right. So there is, I mean, nobody has found out an exact organism level change. But what one has observed is dysbiosis. So there will be, so in a normal person, there are something called firmicutes and bacteroidetes. These are the main microbiome,
Yeah.
and the ratio is two ratio is to be maintained in a normal person. Now this gets altered. There'll be either firmicutes will increase or bacteroids will decrease. There'll be loss of actinomycetes, proteobacteria. This proteobacteria will increase actually. Prevetolas will increase. So this kind of dysbiosis has been observed in first trimester. But to pinpoint to a particular organism, that is not yet been found. That preeclampsia will be able to be diagnostically tell somebody that you'll have preeclampsia. That is not yet done. So that is still to be found out.
But that is again, I think you would require vast studies
Absolutely.
and then correlate, because
Yeah.
these people with the same amount of dysbiosis who don't get PIH and those who have that dysbiosis and do get PIH.
Right. Right. Of
Unless
course.
we
So
have
there'll
that
be other
data,
factors which will also affect. Absolutely.
confounding factors are always there.
Yes. 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 Yes.
So
Absolutely.
a lot of study remains to be done there.
Yes. So see, there are so many it's a polygenic disease. I mean, we have seen we are now actually working on miRNA studies of preeclampsia to predict it in first trimester. So we've got very good results of collection of miRNAs, which will help us predicting the preeclampsia in future.
Where
But
do you collect these miRNAs from?
from the blood sample.
Okay.
Yes, we take the blood sample. So we have yet to finish that 100 sample load, but we have got whatever few samples we have got a very promising results. So, but now the question arises, can you change this miRNA? So no. So now that is why the microbiome comes into picture, which is now known as the altered genetic material. So the one genetic material which one can alter. So that is why it becomes important that we identify the dysbiosis first.
Okay, supposing, this dysbiosis, we are not able to, studies are not there, patient is not able to afford, whatever. Can prophylactic live pre and probiotics be given?
It can be given. The only
But what will be
problem
the overall effect of it?
yes,
It's the
exactly.
cost benefit
So
ratio.
true. So one needs to know first actually that which are the deficient microbiomes, which are the organism which are deficient, and it's better to replenish that first rather than over supplementing it. As you correctly said, somebody gives 10 billion CFUs and 50 billion CFUs. Ideal dosage of a bacteria, let's say Lactobacillus crispatus. So the ideal dosage is only 1 billion CFU. Even 1 billion is fine. But
Okay.
most of the preparations which are available in market gives 5 6 bacterias together. So now whether that is required in the system or not, that one needs to know.
So how do we get to know that?
That is where we come into picture and we do the testing. At least gut microbiome. I can understand the other samples would be difficult, but with gut microbiome, eventually we're going to treat it through gut. It will be most easiest to treat it through gut. So gut microbiome stool sample is the ideal sample for that.
Not even vaginal sample?
No, of course, vaginal sample can also be taken.
So is it a high vaginal or a low vaginal, or a patient can self-sample? What do you say?
Even so self-sampling is not yet done, but what we have tried is that we have got our self-sampling HPV kit. So there we take a high vaginal sample and we have
Mhm.
analyzed those samples for microbiome studies as well. Just to correlate
Yeah.
that how it can be done. So it is giving us a very good idea about what the microbiome status is there.
Okay.
So most of the positives were without lactobacilli.
Okay.
Yeah.
So, because see, it has always been a mystery that 80% are going to get HPV infection.
Right.
80% are going to clear it
Yes,
out
yes.
of those 80. But
Correct.
why those 20% do not clear?
Yeah.
So that is your microbiome.
Microbiome as well, and we are also doing some other research. Sorry, I'm a little
Please
diverting
go
from
ahead.
it,
Please go ahead.
but we are doing today only we process few samples, so we are doing something called integration study. So the correct answer for your question would be that not all HPV infections actually enter into the cervical cells. So
Yeah.
once the CIN happens and the cancer happens, there are about 3 years in between. Persistent HPV infection will also be there. But out of that, which infection is actually entering to the cell and integrating into the cell, that becomes very important, and that leads to, in most of the cases, to cancer. So, of course, lactobacilli, the HPV cannot survive at pH 4. It can survive at pH more than 5, greater than or more than 5. So that is the correlation we could get from doing
Okay.
HPV and lactobacilli study.
Okay. So, there is a lot of fashion of vaginal cleansers. So many companies are coming up with, use this for your personal cleanliness. What is your take on them? How does it help with the vaginal flora or it disturbs it?
We have yet to do that kind of a study to know that, pre and post wash, what happens to vaginal flora. But it's an interesting topic, I must say. We should take it up. Yes.
Okay, because there are so many companies who are women hygiene product, that is what they call it, and they
Right.
sell it. And in the West, they've proved that a lot of these products in the future lead to vulval cancer.
Okay.
Okay, because you are actually disturbing the whole microbiome. It's
Right.
there in the RCOG guidelines as well.
Right.
So, that is one thing that definitely it is disturbing, but we don't have a proof right now.
So might be due to the chronic inflammatory state that must be creating to cause those epigenetic changes in the
Vulva.
those cells. Yes, yes,
Because always it's said that the best way to clean the vulva is just plain water, nothing else.
right.
You use any chemical and it doesn't help. And they say, no, no, this is lactobacillus. No,
Hmm.
this is acidic. And they put up a lot of chemicals in there. So I've
Yeah.
given you some food for thought there.
Yes, absolutely.
So now we've done with obstetrics. Preterm labor, we can understand. Yes, the vaginal flora is changed, and then you get an infection, and it causes the thinning of the amniotic membrane, and there is rupture.
So our experience is that first trimester, if you don't have lactobacilli in the vagina, this has a highest risk of preterm delivery.
Okay,
Yeah.
okay. So that is one part. Now we come to the next thing, that is gynecology, right? So in gynecology, I read your paper that you published on 8 cases where you changed the semen microbiome and
Yeah.
got pregnancies.
Right.
So I read that paper through. What I could not understand was how did the microbiome affect the number? It can affect the quality, yes, but how did it affect the number of semen?
I know we were surprised as well. We have not gone into those, minute details of it, that what are the mechanisms by which it does it, because our study was limited to only 8 patients at that point of time. Now we have gathered about 200 samples, so we'll be doing a bigger study. But all these 8 patients, they were IUI failures, IVF failures. We just gave them 3 months of probiotic. And these were the changes in motility, morphology, even morphology for that matter.
No,
Every,
I agree. With
yeah.
morphology, I can understand.
Yeah,
Motility, I can understand. What I can't understand is the change in number.
right.
So,
So,
come on,
yeah,
you
we
can
get
go
to,
ahead with your
uh,
200 cases and we'll read
yes,
that
yes, yes,
study.
yes, yes.
And now about the mechanism in PCOS. What is
Yeah,
the mechanism in PCOS? I think it will be the almost the same as for diabetes, right?
correct, correct, absolutely. Yeah. So, as we are aware, 50 to 70% show insulin resistance. So, it is the same GLP mechanism which reduces the beta cell proliferation. In fact, there are studies that certain parabacteroids, they release a protein like insulin like peptide. and that causes autoimmune response to it, and that together destroys the beta cell as well, and not only just that insulin like peptide. So
Okay.
GLP, of course, as we discussed, is one of the biggest reason why there is PCO. There is a role of microbiome in PCOS, and now the studies have been happening because of there is a response to Akkermansia. Akkermansia muciniphilia is one of the microbiome which is present in 5% of gut normal gut microbiome sample.
Okay.
And now people have found that just by supplementation of this particular microbiome, there are reduced symptoms, reduced signs in PCOS.
Okay. So these patients means today only I was seeing a patient. She is 143 centimeters, 27 years of age, and 104 kilograms.
Yeah.
And she has come with a pregnancy test positive. HbA1c is 6.4.
Right.
So do you think if I supplement her with microbiome, it will have some effect?
Absolutely.
And what should be added to it? What is the thing that we could add?
So
The
Akkermansia.
content, what should be necessarily be in that product?
No, any probiotics will do for that matter, because we need to establish the tighter junctions first. If there is dysbiosis, we need to address that first. Secondly, the role of Akkermansia will come, which is not that readily available in India actually. All have lactobacilli, bifido, these are all which are available. But Akkermansia is not available, which we'll have to correct it through diet.
So
But
what diet will correct that?
so Akkermansia is mainly in the polyphenol group of substances like fruits and olive oil. All these things have a lot of
Which
Akkermansia.
fruits? Which fruits?
All citrus fruits, all berries will have a lot of Akkermansia.
You know,
Even,
अपने यहाँ means in India, bear भी खाते हैं हम. That is a berry.
yeah. No, no, these are the blackberries and strawberries and all
So
what
they
are
are
there.
not our fruits.
Yeah,
Indian fruit, mein, the berries that we have, like you have grapes,
right,
you also have bear of all varieties, which are
right.
also berries. Will that work?
I've read about the grapes part, but not sure about the bear part.
I think you need to work on it because that is something that each of our people can have. Not
Right,
everybody
yeah,
can go and buy strawberries every day.
true.
So
Yeah.
just some Indian berries that we
Indian
work
food we
on.
need to find out. Yes, yes, yes.
Yeah.
Of course, the curd and all will have definitely have some of it. But if you are thinking about particularly getting it from some fruit, that we'll have to identify. Yes.
And you said olive oil. Olive oil would never have any bacteria in it.
No, no, it won't have bacteria in it. It will cause the increase in polyphenol, which will cause increase in GLP-1. This is the
And
mechanism I was
because
talking
now
about.
we come back to, Gai ka ghee, which
Yeah.
also has a lot of polyphenol.
Right, right. Yeah. Absolutely.
So, because I am more oriented towards what we can have from our Indian diet,
Natural
which anybody
resources.
can have.
True, true, true.
Because PCOS patients, they'll come with, a diet from dietitian, take avocado, take oats. We need to, do some Indian groundwork on that. Yeah,
Yes.
what we are eating, how we can use that to the best. Because India never had all these diseases.
So you have just given me a thought that we have 2, 3 nutritionists on board, and I need to check with them what they are doing about it.
I get, when I see the files, what the nutritionists are giving.
Yeah.
Apple cider vinegar. Why? So I want you to really think about what we can give from our Indian foods.
Right.
India has from east, west, north, south, there is such a range of food that I don't think there is anything that would be lacking in the Indian diet.
Definitely, definitely.
Because in Maharashtra, you will see obesity is less.
Yeah.
Don't take the alcoholics. Other than alcoholics, you will not find a general Maharashtrian to be very obese.
Right.
A Bengali, there'll be so much of diabetes. A Gujarati will have a certain figure where the lower half of the body is rounded. The upper remains thin.
Yeah.
So all this has something to do with the microbiome and the diet, which is actually changing it.
Definitely. I mean, of course, genetic will also play a big role that, what kind of person and what kind of lineage you come from will definitely have a lot to say about it. Of course, the epigenetic mechanisms and microbiome will definitely have a role. Because the same kind of diet, if somebody is having for a longer time, as you said about Maharashtrians, I mean, mostly fish, if they are non-veg, they are having a lot of fish, lot of omega-3, lot of, polyunsaturated fatty acids. So these all things help one again go back to the GLP-1 and PYY, which will, quiet your leptin and increase your ghrelin and
No,
eventually,
even, the Brahmins and all who don't take any non-vegetarian, even them you will not find very
yeah.
obese. Maharashtra is blessed in that way that in general, you go to the village, you'll rarely find anybody obese.
True.
So they are doing something good with their diet.
Yeah. Probably they are probably getting more natural diet than the less pesticides and or chemical food and highly processed food.
So I think, I'm learning a lot and we are providing you with a lot of homework ideas.
I know. Yes, I hope my team is watching.
So now we proceed to the next type for a microbiome study. We, as gynecologists, how can we help you? Because you say that, in obstetrics, in gynecology, there are so many things where it can help us.
Right.
But it has to be within the reach of the common person. It has to be, sort of inexpensive so that a patient, like a blood test, can get it done.
Right.
A simple blood test. In fetal medicine, the NIPT came up with 35,000 rupees fee. And now it is down to something like 6,000 and the uptake has increased.
Yeah.
So how can we help you? What do you expect of us? And what are the types of samples? And what are the focus conditions which you would like to target?
Right. So first of all, it is becoming very difficult to get a pure sample. We are sort of attached to a tertiary hospital. So just to get a pure endometriosis sample, it took us a long time because there was some of the other condition which was associated with it. So my request to all of them who are watching that, please collaborate with us. We are basically a research organization who wants to do a lot of research. Our research is going on in endometriosis, preeclampsia, PCOS. So because we don't have Indian data, we are still relying on the Western data and whatever the recommendations are given by them. So we need to have first the Indian data. Let's collaborate and let's try to have as many samples as possible. So
What
that,
samples do you need?
yeah. So of course the gut sample is always there. Like in endometriosis cases, we'll prefer a endometrial fluid or an endometrial biopsy sample. In a preterm patient, as you said, vaginal sample. So all these samples we are collecting already. I mean, we are collecting from where we are situated in Pune. So we are collecting a lot of samples from quite a few gynecologists here. But like samples of endometriosis, these are very rare
How
samples. I
are
mean,
they collected? What is the media in which they have to be collected? How are they transported?
right. So that is where the right now the issue comes that they all require a cold chain transport or they has to be kept in dry ice till they reach the laboratory. So whether it is an endometrial biopsy sample, a gut sample can travel at 4 degrees Celsius in cold chain. A vaginal swab sample can travel at 4 degrees Celsius, but when it comes to a tissue samples need to be at far lesser temperature. It has to be in dry ice.
-20.
At least -20. Yes, yes. For those, we have to stop those colonies from growing to get the exact amount of a particular microbiome, which will be able to see that there is a predominance
So,
of
so
pathogenic
what is the
process.
fluid in which you're going to collect that? You've taken an endometrious piece. What do you
Right.
put it in?
So endometrial sample comes into saline. because we don't have to put any transport media into that. Just we have to freeze it at -20. But if it's a fluid sample, if it is a swab, we'll prefer it in a DNA stabilizing material with like a transport media. So
Like
like,
in which we take HPV?
yeah, more or less. Digene tube or LBC tube will do, which will have a DNA stabilizing material. It will stabilize it for a longer time.
So this we as gynecologists need to know, no? Otherwise we are totally confused that now we have taken the sample, where what are we going to take it in?
Right, right.
And what are the conditions where you need samples? Like you said, endometriosis.
Yeah. So
And
we can take it in endometriosis, we can take it in infertility cases, even semen
in
sample.
infertility, which phase of the cycle do you want it from? The estrogenic phase, ovulatory phase, premenstrual
Ideally, it should be
phase?
at the ovulatory phase, or
Yeah.
because then we'll come to know exactly the proliferation at that particular time.
Hmm.
So, but if I can understand that will be a difficult task to take that sample. So any other phase is also fine. I mean, as far as, because the colony is not going to change in 2 weeks time. So whichever phase is possible, let's start taking the sample and analyzing it first.
And all vaginal scans are done for follicular study in fertility patients. So that gel is being used.
Yeah.
So does that gel have an effect where it will change the microbiome so that you won't get a correct sample? Because she'll have a follicular study, you'll see that the gel has been inserted.
Yeah.
What next?
It will not affect it because the gel contains only that chemical, but that particular time it will not affect it. It might affect it at a longer time because of some other reaction to it, but not because of taking the sample at that particular time. We have the primers which can directly identify those organisms. So basically, this is done as a next generation sequencing method, and we don't prefer the PCR methods. So that is why it becomes easier to identify all the phyla and species.
In pregnancy, there is a condition called asymptomatic bacteriuria. For
Right,
years, we have known that this is associated with preterm labor. So these patients who recurrently have culture positive, but they have no symptoms. They have no
right.
symptoms at all. So do they require treatment with antibiotics, or we can just treat them with probiotics? And does it, can we alter the course of that pregnancy?
Of course, we can with probiotic supplementation. It will be difficult for me to comment upon whether antibiotic is needed or not, or
She
what.
is asymptomatic totally, but the
Right.
culture is every time it's positive.
Correct. But then if it is staying positive for a longer time, if there is a cultural colony growth of pathogenic bacteria for a longer time, we might have to give it to prevent other issues with it. But probiotic supplementation needs to be there because that lactobacilli will reduce the pH and will prevent the further occurrence of these bacteria. But we have to always remember that at least 2 hours gap should be there. I see lot of antibiotics with probiotics, which
I have to prescribe them at a different meal time.
yeah, absolutely. That is ideal. I mean, antibiotic with probiotic is not serving any purpose to anybody, actually.
Yeah. So I would always say, take this at one meal time and take that at the other meal time.
Best. Yes, right.
So now you would say that this asymptomatic bacteria patient, we give her probiotics. For how long? Do we give them throughout pregnancy? Do we give them twice a day or once a day?
So,
And how often do we repeat the cultures now?
yeah. So, any probiotic can be given up to 3 to 6 months. There are no harmful effects yet to be found in pregnancy. They're all safe in pregnancy. As I said, one needs to confirm only that each bacteria in that should be at least 1 billion CFU. That is enough. The required daily amount is not yet identified. Somebody will say 10, somebody will say 20. So there is on literature, there are all different scenarios as far as the RDI is concerned for these probiotics.
Okay.
Yeah.
So along with these probiotics, apart from this, that you have to, take it at a separate meal from your antibiotics and other medicines, what are the dietary enhancers that you would advise? Curd is one. Curd and matha means, what do you call it? Buttermilk.
Yeah.
Curd
These
and
are the best.
buttermilk. But
Absolutely.
other than that,
So other than that, what you said is that, they are on the expensive side, or, these are the easiest form of probiotics one can have in India. But of course, there are these kimchi salads are there, and there are quite a few things which are available, which are there in Western countries and not as much as in India.
I'm talking
Also,
about
idli
us,
and
our
dosa.
general person,
Yeah.
what they can include in their diet every day
So
to improve their health, to maintain a good
yeah.
microbiome. What do
So
you
as
think
you,
of pickles? What
of
do you
course,
think of
I was
pickles?
just coming to that. Five things: curd, buttermilk, idli, dosa, and pickles. These are the easiest available Indian foods which one can have to have a lot of probiotics in them.
Okay. Okay. So I think we've done quite a bit. Is there anything that you would like to say at the end? Anything to us gynecologists?
No, see, first I like to say, you're gonna laugh at it, but still that we need to do this testing. COVID started at 5,000, we ended at 500. So at least for this affordable patients, let's try to do this testing, because unless we do this, we'll not be able to come to know that, what are the implications. We are really finding very, very good results. Now we are targeting almost individual microbiomes, like I said, PCOS, Akkermansia, endometriosis, Lactobacillus gayseri. So now we are identifying each microorganism's role, and also which we will be able to give
What
to the
about
patient.
cancer? We forgot to say
Yes,
anything
yes,
about
yes.
cancer.
So,
Which cancers specifically
mhm,
are caused due to change in microbiome? Once you get cancer, the microbiome is going to
yeah,
change. That is a
right,
different story altogether. Once the
right.
TNF factor is blocked. But why did it get blocked in the very beginning? Which ones are associated?
Correct. So all these cervical, ovarian, and endometrial cancer, there are role of microbiome which has been found already. As I discussed with you about the cervical cancer, the HPV part, that because of lactobacillus, even endometrial cancer, I'll go one step further, that there is a proteobacteria which has been correlated to, if it is found present in that endometrial cavity, there is a higher risk of being an aggressive tumor. So there is research happening like this.
Because
That
there is the new classification of endometrial cancer where they are taking pole mutations and MMR and
right, yeah,
P53. So
correct.
those can be activated by change in microbiome.
That is being assumed in as one of the theories, as I discussed with you, that chronic inflammation for a longer time will lead to the epigenetic mutation. So everyone has a mutation in their body.
Yeah.
Why does everybody don't come up with this? Because there are certain mechanisms like epigenetics which works on shutting down or waking up
Enhancing.
that mutation.
Yeah.
And that actually leads to, so this is one of the contributory factor microbiome will be in causing these epigenetic changes.
So, one thing again that I would request from you for all of us, because you are based in Pune and somebody is maybe in Trivandrum and they want to
Right.
send you an endometrial sample. How does it get done?
So basically they just need to give us a call. We'll pick up the samples. We have tied up with all
Oh,
people.
means, but how, they need to be, there has to be an SOP. How
Right.
to
Yeah.
handle that specimen? Getting dry ice means if I have were to get dry ice, I don't know where I would get it from.
Right. Right. Right.
Right. So, like the lifestyle people, they come with, their whole kit that you
Yeah.
take a sample in this and give it to us.
Right.
So, I think the more people get involved with you, you would need a mechanism like this to actually get the samples.
True. True. So if we have given the intimation before, we do send the kids. For cervical, vaginal, we are regularly sending the kit. For gut also, we are picking up samples from right till Chennai to, we have picked up samples in Delhi also for gut microbiome. So we are trying now for Dubai also actually. So, these kind of places we are trying.
But you were placing so much emphasis on the endometrium, and that's why I asked.
No, endometrium, that was my research, why I was pressing upon it, because we want to do that research on endometriosis and recurrent implantation failure as well. So these two conditions we are focusing on right now. We are actually starting an animal study very soon for PCOS and
What
endometriosis.
have you found in RPL?
So RPL, recurrent implantation failure, we have found out that it is the lack of lactobacillus which is causing again the chronic inflammatory environment that is contributing to, because we are doing ERA, we know when to implant and this and that, but then again this could be one of the reason for rejection that
Okay.
we are now identifying.
Okay. Okay.
Yeah. So there is a lot of research to be done. So my request to all who are listening is that let's have our Indian data ready. Unless we have our Indian data, what you also correctly started with, that we are reading a lot of Western literature. And this was the reason why we had to, give that review article in Figo as well, that, let's just start doing something on that.
Okay. So I think I've really taken up a lot of your time, but I learned a lot and a lot of new avenues are open. I
Yes.
thank you so much, Dr. Sarjan. Thank you so much for being with us. I also thank my viewers and Pradeep from the support team. I also thank Sunita ma'am who has given us this opportunity. Thank you so much, ma'am. Namaskar. Good night.
Thank you, ma'am. Thank you.